I think the first thing to tell them is to give them a flavor for what is the risk of Serogroup B meningococcal disease. And fortunately, both in Oregon and across the United States, meningococcal disease has become pretty uncommon. We're on the order of 1 case per million population per year in the state of Oregon, and a little bit higher among infants and adolescents, but still pretty uncommon. The vast majority of people are never going to get the disease with a vaccine or not. The second thing to note is that the vaccine is pretty new. Both of these vaccines are pretty new, and their efficacy is inferred based on their ability to produce an antibody response directed against some proteins on the surface of the vaccine. This is unlike the immune response generated by the quadrivalent vaccine that has been around for several years. There, the antibodies are directed against the capsular polysaccharide, and we have better evidence about the ability of a certain antibody level directed against the capsule to protect against meningococcal disease. We're sort of making inferences about the ability of the Serogroup B vaccine's antibodies directed against proteins to have the same sort of protective effect. And finally, we don't know how long this protection, if it's there, will last. So those uncertainties in where we are in the history of the vaccine right now, coupled with the relative rarity of the disease, mean that the Advisory Committee on Immunization Practices made a less strong recommendation in favor of its use among adolescents. They gave it a Category B recommendation, which means consider it after having a discussion with the parents. Well, theoretically you could if you wanted to, but we're encouraging, and the ACIP was encouraging, some clinical decision making to be undertaken on the part of you, the physician, as to whether the vaccine really should be given. Remember that it's a pretty new vaccine. We think it's safe, but there's always the possibility of some rare but serious side effect. And that's being weighed against the fact that the disease has become quite rare. So you have to balance those two factors, in addition to things like, are there other things that might put my child at increased risk over and above the average? Perhaps something about the social networks. Is there more contact with other people from whom the meningococcus might be transferred? Is there anything in my child's medical history that might indicate an increased risk for meningococcal vaccination? And then, of course, the cost of the vaccine may play in as well. Well, the ACIP has recommended universal use of the quadrivalent meningococcal vaccine, the one directed against ACY and W135, in the adolescent population because they are at higher risk than the general population for that disease. But remember that Serogroup B disease causes less illness than C and Y combined. Overall, Serogroup B accounts for only about a third of meningococcal disease. That's true in Oregon in recent years, as well as nationally. And in addition, the Serogroup B disease is based on a different and newer immune response. The previous vaccine was based on antibodies directed against the capsular polysaccharide. And we've known for many years that a certain level of antibody directed against the capsule would be protective. The Serogroup B meningococcus doesn't produce much of an immune response to its capsule, and so they had to make the vaccine directed against some of the proteins on the surface of the Serogroup B meningococcus. And it's not quite as certain that the level of antibody that it produces will be effective. So we have fewer data with this newer vaccine. We don't have data on duration of the antibody response as we're starting to get for the quadrivalent vaccine, and the disease is less common. So for all of those reasons, the ACIP did not make a recommendation that every adolescent should get it, but rather that you should consider its use in adolescents based on a weighing of risk factors and efficacy of the vaccine. In contrast to the quadrivalent vaccine, for which the ACIP recommended universal use in adolescents, the Serogroup B vaccine is being recommended not for universal use, but for use after individualized decision making has been done. So they wanted the conversation to take place weighing the relative risks and benefits of the vaccine, as opposed to simply giving it and recommending it for every adolescent who walks in the door.